Those in favor say, and the contrary, nay.
Under Clause 39 of the bill, the Ministry of Health had sought to make it mandatory in the event of the occurrence or threatened outbreak of any disease to conduct vaccination or revaccination of all citizens. Despite persuasion by the Health Minister Jane Ruth Acheng that the clause was intended to ensure compliance and to protect others, the House resolved that it was the right of any citizen to make independent health decisions in case of new diseases where the efficacy of the vaccine is yet to be proven. The MPs wondered who takes liability in case of any side effects.
Vaccination of adults is not an easy thing. And I will give you two examples. This Parliament directed that we vaccinate adults for hepatitis B. To date, the response has been poor. First dose was very good, subsequent doses very poor. Likewise, vaccinating adults for COVID-19 has been an uphill task. However, Right Honourable Speaker, I want to request that in dealing with this bill, we should look at two sides. There is the health side and also the human rights side. And this is where we have to be careful when we are passing this bill.
Honorable Member, the Minister has clarified that you cannot force people into mandatory vaccination. Adults, however,
because there are vaccines that are new, where the manufacturer doesn't want to bear any liability, not even the government. So if you're to vaccinate masses using a new vaccine and you do not want to bear liability, you do not want to compensate anybody who derives an adverse effect out of that vaccine, then the onus should be on the person taking on that vaccine.
Aside from the 10 childhood immunizable diseases like polio, tuberculosis, hepatitis B and measles among others, the House under Clause 31 repealed the Immunization Act and called for the permission from a parent or guardian before immunizing a child from any new disease.
the children, there are those sickness, the vaccinations that are mandatory. And of course, you cannot vaccinate a child without a consent of a mother or a parent.
Let the parents take a decision whether their children deserve to be vaccinated or not. What if they get problems? You're going to be sued, and the government will be in hot soup when the parents react by suing them for vaccinating their children.
The House has also made it clear that no fee should be charged for vaccination by a public vaccinator or for a certificate. Stringent punishments have also been prescribed for those who will violate the provisions of this law. For failure to comply with the notes to cleanse or disinfect a building, one will be fined 1 million shillings. Failure to provide a public vehicle for disinfection attracts a fine of 100,000 shillings, and anyone who lets an infected house will pay 2 million shillings upon conviction. Failure to repair defective latrines attracts a fine of 1 million shillings, and anyone who fails to keep their yard free from bottles, whole or broken, will be fined 100,000 shillings. It is 1 million shillings for failing to clear bush or long grass, 100,000 shillings for failing to cover water in an open vessel, container or space, and 5 million shillings for residing in a room where foodstuffs are kept. The bill awaits assent by the President. The bill awaits assent by the President. Herbert Ziwa, NTV at Parliament.
Explicitly evaluated and discussed through ethical analysis.